This is my PowerPoint on alcohol use and abuse for educating the community. My name is Cindy Robinson. I'm an Indiana State University nursing student. The objectives for this PowerPoint is the community, by the end of this slide, the community will understand what binge drinking is, what alcohol abuse is. The community will understand the risk associated with abuse. The community will understand the dangers of detoxing. The community will understand where to get help. I'd like for you to take my pre-test before we begin. Alcohol use and abuse, according to the Center for Disease Control, drinking in excess, it includes activities such as binge drinking, defined by the CDC as on occasion having 5 or more drinks in a 2 to 3 hour time frame for males and 4 or more for females. Drinking in excess can also be defined as more than 14 alcoholic beverages per week for men and more than 7 for women. Excess use includes those who are pregnant, under the age of 21, having any alcoholic beverages. The warning signs that there may be a problem is binge drinking, periods of memory loss or blackouts, making excuses to drink, drinking instead of meeting obligations such as work, drinking alone, extreme mood swings, and self-isolation. According to the CDC, approximately 95,000 deaths annually can be contributed to the excess use of alcohol. The health conditions that can arise from alcohol abuse is cancer, heart disease, high blood pressure, liver disease, stroke, impaired judgment, birth defects, decreased ability to fight infection, car accidents, injuries, violence, destruction of family dynamics, depression and anxiety, sleep interruption, and suicidal thoughts or attempts. Alcohol can increase the risk of liver cancer, mouth cancer, breast cancer, throat cancer, colon and rectal cancer. It increases the risk of cancer by damaging the way that the cells of the body operate. This can lead to the cell growing in an uncontrolled way and eventually leading to cancer. According to the CDC, every 50 minutes, one person dies due to a driver under the influence. In 2016, impaired driving accidents took the life of 10,497 Americans. This comes out to about 28% of all crashes in that year. The yearly cost of these accidents are estimated at greater than $44 million. In the same year, 2016, over 1 million vehicle operators were arrested for DUI. Based on the behavioral risk factor surveillance system, the estimation for impaired driving episodes is over 120 million annually. The legal limit for blood alcohol concentration is 0.08 in all states. However, penalties for driving under the influence of drugs and alcohol vary from state to state. The blood alcohol concentration increases by approximately 0.02% with every drink consumed. The NIH suggests that the level of individual impairment can vary greatly, even with the same amount of consumption. It's based on individual size, gender, and fat to muscle ratio. Through many studies, the NIH found that a blood alcohol concentration level of 0.05% may show signs of impairment with reaction time, eye movement, driving simulators, hand and eye coordination. The NIH also discovered impairment with some individuals at 0.02%. There are many alcohol abuse screening tests. The World Health Organization developed a tool for the detection of alcohol abuse called the Alcohol Use Disorders Identification Test, or AUDIT. There are 2 versions, one for healthcare providers and one for self-assessment. An 8 or greater is indicative of abuse, and I've included 2 links for those tests. Sudden cessation of alcohol consumption after long-term abuse can cause withdrawals. Symptoms are fatigue, depression and anxiety, irritability, mood swings, headache, insomnia, rapid pulse, clammy skin, and shakiness. Nightmares, anorexia, confusion, in a more severe form called delirium tremens, seizures, hallucinations, fever, and agitation. It is highly recommended to detox under the care of medical professionals. Withdrawal begins approximately 8 hours after a person takes their last drink, and symptoms can last up to several weeks. The symptoms aren't the same for everyone. Stage 1 is least severe, and symptoms vary, but can be loss of appetite, fatigue, nausea, heart palpitations, tremors, vomiting, anger, and depression. Stage 2 begins 1 to 3 days after the last drink. It's more serious, and symptoms can include confusion, irritability, difficulty breathing, sweating, high blood pressure, and rapid pulse. This can last several days. Stage 3 can be dangerous. Begins approximately 3 days after the last drink and includes seizures, hallucinations, and high fever. If these are experienced, immediate medical care is needed. Not every stage is experienced by everyone, and not everyone even experiences symptoms. It's dependent upon factors such as the length of time of the abuse, type of alcohol abused, such as beer or liquor, family history of alcohol abuse, and overall health, including mental health. Here are some places I've included you could go to get help for alcohol abuse, and I've included the links. There's also government assistance, many forms, and I've included phone numbers here as well. Fetal alcohol syndrome occurs when a fetus is directly exposed to alcohol because the mother consumes alcohol during pregnancy. This can result in brain damage, birth defects, growth problems, behavioral problems, and cognitive impairment. No amount of alcohol consumption is safe during pregnancy. The physical deformities that can arise include limbs, joints, fingers, vision and hearing problems, small head size, heart defects, and facial deformities. The brain and central nervous system can also be affected and can cause difficulty solving problems, poor judgment, hyperactivity, and poor coordination. Behavioral issues can be unable to adapt to change, difficulty with social situations, and impulsive behaviors. According to the World Health Organization, alcohol abuse and domestic violence often go hand in hand. Alcohol directly affects self-control ability, which can lead to one who is under the influence being unable to solve conflicts without physical violence. The World Health Organization further found that in approximately 55% of domestic violence cases, alcohol was involved. The risk factors of domestic violence with alcohol includes heavy drinking and/or often mental health issues, particularly in males who have antisocial personality disorder. In the U.S., the cost of domestic violence is estimated to be over $12 billion a year. Here I've included help for victims of domestic violence, the domestic violence hotline and the website, domestic violence for your area, shelter programs, and the National Resources Center on Domestic Violence. According to the 2020 Dietary Guidelines for Americans, adults should either not consume alcohol, or men have less than 2 a day, or women no more than 1. Know the warning signs, ask for help. Those who should never drink include anyone operating a vehicle, anyone who is pregnant or think they might be, operating heavy machinery, taking prescription or over-the-counter medications, under the legal age, or have health conditions such as heart, liver disease, diabetes, depression and anxiety, or high blood pressure. Thank you.